HealthShare Health Insight is a platform for developing targeted analytic solutions using rich, normalized data collected by HealthShare Unified Care Record. It leverages the component patient record as built by data collections in Unified Care Record for targeted analytic applications for health population performance improvement. Health Insight offers smart, incremental updates for near real-time access and can incorporate data from multiple data sources, including data from outside HealthShare. To enable care management at the point of analysis, Health Insight includes automated event logic, notifications, and management actions that allow users to react immediately to discovered situations. This closed-loop management capability enables interventions to begin at the point of care. In short, Health Insight is a robust analytics development platform that unlocks the value of shared health information for population and performance management. Let's take a look at an example. Charles is 53 years old and male. He's never had a screening test for colorectal cancer, and his family history of cancer indicates he has a higher than normal risk. Let's take a look at a scenario where this gap can be closed. A care coordinator, tasked with improving the overall health of a population, can take advantage of the rich data collected from different sources and shared on Unified Care Record, and look across the health details of a population using analysis tools. A care coordinator can set up criteria in Health Insight that automatically identifies patients due for certain preventive screenings, for example, a colorectal screening, by assigning criteria to the patient population based on age, family history, diagnosis of colon cancer, or previous screenings. Health Insight can identify at-risk patients like Charles and review their screening records to determine who has a gap in care that needs to be closed. In this case, the gap would be a missing or overdue colorectal screening test. The care coordinator can then take actions to ensure these screening tests are offered to patients like Charles in provider programs or by the patient's main care provider. Health Insight can also assist care coordinators in manually or automatically enrolling patients into risk-stratified cohorts to ensure timely care coordination. For example, we can use risk stratification with a population facing issues with blood pressure control and uncontrolled hypertension. The care coordinator can introduce into Health Insight selection criteria such as patient demographics, family history, social history, and other clinical criteria. From these criteria, the care coordinator can manually create a group of patients taking medication to control blood pressure who have not been diagnosed with hypertension. Health Insight can also create this type of group automatically. Another group will include patients with elevated blood pressure who have no prescribed medication and no diagnosis of hypertension. Finally, a third group will include patients with elevated blood pressure who are currently taking prescribed medication and have a diagnosis of hypertension. With these three groups determined, the care coordinator can take appropriate action to ensure timely and correct care for all patients involved.